Welcome to the Illuminating Primary Care podcast, a general practice podcast brought to you by Menlo Park Recruitment. Illuminating Primary Care is here to quiz primary care leaders to offer professional knowledge, experience and insight on the biggest topics in general practice. It's the podcast to listen to if you work in primary care. Welcome to the Illuminating Primary Care podcast.
Hello again, everyone, and welcome back to part 3 of the series that I've been doing with Dr. Mateen Ellahi. Mateen, thanks again for joining me for this third and final part of our little series. I think today's topic is really quite an interesting one, and it broaches a topic that something that we as an organisation have not particularly come across, and I imagine if we haven't, probably the majority of GP land probably hasn't as well. I think it is quite a novel concept and one that's got huge potential. So we're talking about the role of GP consultancy, new as a GP, going into practices and acting as a consultant in the same way that management consultants would go into organisations from a management standpoint, but you going in as a GP partner in your practice and advising them from a clinical point of view as well as that partnership aspect. So yeah, explain the role and kind of how this has come about.
Yeah, firstly, thank you so much, Matthew, for having me again. It's a pleasure to be here and good to see you again. So, yeah, we discussed this briefly, didn't we? That there's a gap in the market where you can clearly see that some practices are struggling financially or regarding patient outcomes, access-wise, due to various issues in NHS, really. So, after my MBA, most of the colleagues of mine were doing consultancy roles. I didn't really know much about consultancy. However, I saw a gap in the market where I feel experts, I'm not calling myself an expert, but people who are experienced as a GP, who have a know-how and their practice is doing well, so they're implementing those changes, can fellow colleagues as well. So I feel there's a huge role for GP consultancy. I'll point out few things which I believe a GP consultant may be able to do. I think number one would be conducting a comprehensive assessment of the practice operations. It could just be the operation of the practice. It could be financial flows. It could be the quality of care as well. And then based on the assessments, the consultant or the consultancy team could collaborate with the practice leadership, be it practice partners or practice managers, to develop a turnaround plan tailored to the practice needs. Also, I think helping the practice develop budgets, monitor expenses, especially in this day and age with the new GP contract coming out. There's a huge uproar about the potential expenses that will be in primary care. I think the other aspects would be, again, as I mentioned, streamlining workflows, redesigning processes, and eliminating inefficiencies, which I'm quite big on, I would say. And lastly, I think the other metrics that people sometimes don't consider, I think, is it's providing coaching and support to the practice leadership. Sometimes you, as a practice manager, can be left alone because the partners are extremely busy with clinical work or managing other aspects of the surgery. So as a practice manager, you sometimes can be alone. And I know there are practice manager groups out there, but I think the practice managers and the leadership would benefit from some coaching and training and support as well, from externally. I think the other things would be, as any consultancy role, you would need to establish key metrics or key performance indicators, KPIs, essentially, to monitor and assess whether the changes that you have made are actually making a difference. And I think this is the part that most consultancy projects lack. They don't know, they make the change, they know where to improve, they come up with ideas to improve it, but they don't really measure if the changes have been made or have actually made a difference. And that's where KPIs come in. And I think finally, it's quite important nowadays, I would say, is a consultancy team needs to work with a practice to develop strategies for the long-term sustainability of the practice, helping them establish a culture in the practice for adaptability, innovation, and nowadays, obviously, ultimately AI and digital health will come into play as well. So I think all of those metrics needs to be taken into account.
Yeah, and it's that stage process, isn't it? You've got to deal with the here and now. But then once you change the here and now, you've got to make sure that the incident afterwards is working after as well. But then also continuing into the long term, not just while this consultancy period is ongoing. Why do you think, Mateen, that this is not more commonplace? So practice managers or managing partners, non-clinical leaders in primary care going in and consulting in practices is, if not necessarily common, it's certainly quite a long-standing concept. Why do you think it's not more common for GPs to be doing it from a partner's point of view?
I think there's various factors. I think the number one factor that I've seen is people do everything so differently. Practices, most practices are doing everything or most things very different. So to have someone coming in and to make huge amount of changes would require a lot of work. And practices, I feel, don't want someone to come in and say, you're lacking in all of these things, make changes, and these are the changes. And where the consultancy project would differ would be a consultancy team who would come in and identify the barriers, identify where we can make potential changes, not all the changes, and you can't replicate each practice either. It's not a copy and paste. And guide people through it and coach people on, if those barriers ever came about again or different barriers came, how the approach would change to navigate those hurdles essentially. And I think the huge role in consultancy is coming due to factors such as the contract and the new NHS contract mentioning about access to care, where access is paramount for patients. I think there was recent news about 60 GP surgeries closing just in one year, just last year. And then last but not least is the public opinion and how the public opinion is generated by the media. And unfortunately, the media isn't the nicest to primary care really, and there's a lot of negativity. So we need to come together as a team and help improve that.
Okay. So at what point then would a practice engage someone like yourself to go in as a GP consultant? What would be the telltale signs that maybe they need this help? At what point should they be sitting up and thinking, hang on a minute, we need to do something about this and look at another avenue? What should they be looking out for in their practice as indicators that they need this help?
There's lots of indicators you can look at, isn't it? So you can actually look at whether first of all, are the patients happy? Well, at the end of the day, your doctors or your clinicians to provide good care for patients. So directly just asking the patients. It doesn't have to be Google, it could be Google reviews, or in my opinion, a fairer reflection would be the NHS survey that happens every year or every 6 months. Just have a look at that and where people are below the national average, or you shouldn't try and compare to national average, you should try and do as best as you can. Set goals and try and achieve them. So those would be the indicators for you. And then you will need to come together as a team of practice partners and the management and see how you can improve those indicators. The other factor would be just the PPG, with the patient participation group. Ask them directly, see how they can improve. And last but not least, and this is probably the number one thing that we look at after the patients, is the staff. Respectfully, just asking staff. At the end of the day, every staff member, including yourself, is a patient as well. So asking the staff, where are the inefficiencies in, let's say, the reception, the admin team, the nurse practitioners, the clinicians, the registrars, even the university students that are coming in. Ask them where the inefficiencies are, and they might be able to say, you just be open to suggestions, and that will help as well.
So obviously, this is a business idea. This will run in parallel next to your partnership, and there's a financial appeal to offering the service and developing your own portfolio as a clinician and as a career. That aside, though, what does this role give you personally, and what will it give others who are maybe looking to get into offering this kind of service?
So my two biggest passions are practice management or management essentially, and being a clinical doctor. And I think I wanted to combine both of those. And I think the skills I've used through the MBA, I would love to kind of provide those skills to other people if possible. And I want to use those skills. So I have managed to use those skills in my practice. And thankfully, we're going in the right direction, I believe. But I'm very passionate about utilizing those skills to help my fellow colleagues as well. Secondly, I think networking opportunities. To be honest, I never was a social media person until LinkedIn over the last 6 months or so. But now I try and have 2 or 3 meetings every week, it's amazing to just grasp knowledge from so many different types of people and clinicians, and building relationships with other healthcare professionals, administrators, industry stakeholders like ICS, ICBs can only lead to collaboration opportunities in the future. Thirdly, I would say continuous learning and growth. So consulting in different practices will expose me hopefully to a variety of challenges, perspectives, and solutions. So not only will I hopefully be able to help, but I'm sure I will be gaining a lot of knowledge from others as well. Fourthly, I think it will only enhance my own reputation in some aspects. Hopefully, if I have successful collaborations with other practices, it will enhance my name, and hopefully then that will lead to other collaborations in the healthcare community. And lastly, and I think this is probably for me the most important, it kind of ignites my passion. I would love to do it, and I think I love doing it, and I would love to do it further, and it will develop me as a better clinician and a manager in the future.
Yeah, no, good to hear. So longer term then, in the hope that this becomes more commonplace, how do you see it evolving? Do you think this would continue with, GPs like yourself and your peers across the country acting almost as sole traders in this regard, and having their own individual consultancy businesses? Or can you see LMCs or ICBs having this kind of resource internally, where they can second out either people on a contractor-based arrangement like yourself, or an in-house resource that they can actually then, as I say, lend to practices for a period of time to help them with turnaround projects? How do you see the growth potential of the role itself?
That's a great question. So I think it'll be a bit of everything. I don't see one tactic winning, i.e., a sole trader always being the primary care consultant. I think there's pros and cons, isn't there? I think a sole trader would provide you with like personalized consultant service tailored to the practice needs or the individual themselves really as well. And that would allow for some flexibility and agility in addressing specific challenges that the practice may face. LMC, on the other hand, represents, I guess, the interests of general practitioners within a specific area. They'll play a crucial role in supporting and advising practices on various matters. So the LMC could potentially expand their services to include consultancy teams, which could then be tailored to practice management, clinical governance, quality improvement, etc. And lastly, I think ICBs, I guess, are the fund holders, so they would have access to know-how or which practices may need help, as well as which practices might be doing really well in that geographical area, and then join both groups of practices, so to say, to help each other. They're obviously a larger healthcare organization and a network. So these entities often will have a wide range of resources, clinical expertise, technical solutions as well. So I think all three will offer different types of roles really in the future.
Well, it sounds like what you're saying there, though, is all three could almost exist harmoniously together. You could have your individual consultancy businesses, but they could work perhaps in tandem with the ICB, who could introduce them to the practices who need the help. So how do we grow the numbers of GPs who actually want to offer this service? As I say, it was a fairly novel concept when you and I first started discussing it, for me at least. How do we get the message out there that there is a need for this and get more partners and GPs like yourself interested in providing it?
Yeah, so there's a few factors here. I think number one would be educating it, and maybe developing training programs to equip GPs. So could we have an MBA style where GPs learn the management and business administration specific for primary care? Could we have potentially mentorship or apprenticeship schemes where a healthcare consultant could teach potentially, GP registrars in their ST3 years, or a newly qualified partner um, who aspires to be a primary care consultant? Maybe encouraging networking and collaboration platforms. And I think, lastly, to really promote it, you need to recognize and incentivize really the clinicians or managers who are doing really, really well, to recognize them, and then to incentivize where you want to promote something, you need to kind of encourage it. And I think if there's encouragement there, and then more people will be willing to enter that space, and hopefully then the wider community will benefit.
So is this maybe where we plug in the LMCs and the ICBs then? Because that encouragement obviously has to come from somewhere, doesn't it? So maybe it needs to be, as much as obviously GPs like yourself doing the self-promotion and actually raising awareness of this opportunity and this offering, there needs to be things done from a regional level and even potentially on a national level to understand the value of this and actually promote the need for it amongst those high performing practices. Because obviously it can't just be, you flying the flag yourself, with a few others like-minded. I think there has to be a sort of a joined up coherent approach.
Totally agree. I think it has to come from higher authorities. One practice or one person is going to make minimal difference. If the higher authorities, like the LMCs, the PCNs, the LMCs, the federations, then the ICBs, all make a joint effort that they want to promote something and want to make their ICB or their PCN the best, and are open to change, open to willingness to learn, then it's only going to benefit those practices.
Yeah. Is there an end goal? Do you see, other than the aspiration to just help as many practices as you can, I guess, and the personal benefits that will bring? Is there a goal with this in mind? Do you see an eventuality where this has become commonplace enough and enough skills have been shared and learned where these services aren't needed anymore?
I personally don't think there will be an end goal, and I think because there's the healthcare industry, if you want to call it, is quite complex and dynamic, and it's ever changing. If you want to look at the advancements in medical technology, AI, changes in healthcare policy, which seem to be happening on month-on-month basis, the regulations, the shifting in demographics, so all of these changes mean that I don't think there will be any end goal to this. So the more people who want to join primary care consultancy, I think I would highly encourage that.
Okay, brilliant. So looking at you and your efforts from your regional point of view then in the Northeast, what's the next plan for you? How do you plan to take this further and actually expand the offering? How do you plan to get that word out there that the help is available from GPs like yourself? And how do you plan to go and actually start providing it?
So we've been already doing this as a practice over the last few months. We've been, a couple of years now actually, we've been collaborating with our local PCNs, but at a bigger level with the local federations as well. As you know, through my LinkedIn, I've documented that we've been helping our federation with access to care for all the local tens of thousands of patients locally, to provide help for other practices. I think so. Engaging stakeholders, engaging healthcare organizations, professional organizations, government agencies, if you can, ultimately, essentially building relationships and partnerships, which will then expand the consultancy offerings.
Okay, yeah, no, sounds like a good plan. So for practices interested in investigating this further and actually speaking to you directly and seeing what insight and solutions you could potentially offer them, how are they best to get in touch with you?
So everyone's welcome to reach out to me on LinkedIn. I don't have any other social media, so that would be probably the best place. I have to say I'm very grateful to the LinkedIn community. I think they've been very welcoming, everyone. I've had various thorough, meaningful conversations with a lot of experts. I've gained valuable insights from fellow healthcare professionals and management consultants, which has kind of weighed me towards possibly a primary care consultancy role in the future. And if you have any specific concerns about your practice or you just need advice, feel free to email me. It's mateen.ellahi@nhs.net, or again, ping me on LinkedIn, and I'm happy to schedule an introductory call to discuss possibly how I can assist you. And if I can't assist you, hopefully I'll know of someone who may be able to help.
Brilliant. Mateen, thank you again.